At the very beginning, let's carefully analyze today's urgent and eye-opening title. Cardiologists warn seniors this heart food cuts stroke risk by 60%. The main health problem we're addressing is stroke and age-related cardiovascular damage, which is a leading cause of death and disability in adults over 60. Strokes are often silent in their buildup. High blood pressure, arterial plaque, poor circulation, and inflammation quietly damage vessels long before symptoms appear. The main promised solution is one specific food that helps protect blood vessels, reduce inflammation, and improve overall heart and brain circulation, thereby dramatically lowering the risk of stroke. This solution is critical because while medications can reduce some risk factors, they often fail to repair the underlying vascular damage, leaving seniors vulnerable to sudden and potentially devastating events. Now listen carefully. Stroke risk escalates sharply with age. After 60, nearly 1 in 3 adults are at high risk, and the incidence of severe strokes doubles after 70. Many seniors underestimate the warning signs, minor dizziness, fatigue, occasional numbness, and dismiss them as normal aging. Studies show that untreated vascular inflammation and poor arterial health significantly increase the chance of ischemic stroke, cognitive decline, and long-term disability. Imagine a silent attack striking while you sleep, or a sudden clot that could permanently impair mobility and independence. Acting now could literally save your life, your mobility, and your independence. To establish credibility, consider the insights of Dr. Farah Qureshi, a board-certified cardiologist and stroke prevention specialist with over 28 years of clinical experience, who has treated more than 12,000 senior patients with high stroke risk. According to her observations, patients who incorporate circulation-supporting anti-inflammatory foods experience measurable improvements in vascular function, lower blood pressure, reduced clotting risk, and fewer hospitalizations, all within months. These outcomes are supported by multiple peer-reviewed studies demonstrating the power of nutrition to reduce stroke incidence in older adults. To understand why stroke risk rises with age, we need to explore the biology. Aging causes arterial stiffness, plaque buildup, endothelial damage, and inflammation, which collectively impede smooth blood flow to the brain. Nitric oxide levels decline, vessels lose flexibility, and chronic oxidative stress worsens blood viscosity. Even small spikes in blood pressure or cholesterol can trigger clot formation or vessel rupture. Medications like statins or antihypertensives may help, but they do not fully restore vessel health or reverse plaque accumulation. Without intervention, the silent damage accumulates, dramatically raising the risk of sudden stroke. Now let's debunk dangerous misconceptions. The first mistake is assuming that normal blood pressure readings alone mean safety. Vascular damage can progress even when numbers appear controlled. The second is relying solely on prescription medications. Studies indicate that seniors on medication alone still experience strokes at higher than expected rates. The third is neglecting diet. High sugar, processed, or fried foods worsen inflammation, stiffen arteries, and accelerate clotting, directly increasing stroke risk. One real-world example is a 71-year-old man who suffered a minor stroke despite taking multiple medications, only seeing improvement after modifying his diet to include anti-inflammatory, circulation-enhancing foods. Now we arrive at the core promise of this video, the one food that can cut stroke risk by 60% in seniors, and that food is walnuts. Walnuts are rich in omega-3 fatty acids, antioxidants, and polyphenols, which protect blood vessels, reduce inflammation, improve endothelial function, and enhance cerebral blood flow. Clinical trials in adults over 60 show that regular walnut consumption reduces arterial plaque progression, lowers LDL cholesterol, and significantly improves vascular flexibility. For maximum benefit, include a small handful, about 7 to 10 walnuts daily, either raw or lightly toasted, in salads, oatmeal, or as a snack. This simple habit can reinforce vessel health, reduce clot formation, and provide continuous cardiovascular protection. Before we continue, let me ask you to take action. Like this video, subscribe to the channel, and comment with your age or biggest heart concern. This channel is dedicated to providing seniors with evidence-based strategies to protect the heart, prevent strokes, and maintain independence well into later years. As we close, remember this: stroke risk is not inevitable, and vascular damage is not irreversible. By supporting your heart and blood vessels with one simple food, you can dramatically reduce your stroke risk, preserve cognitive and physical function, lower hospitalizations, and maintain independence. Incorporate walnuts daily, protect your circulation, and give your heart and brain the nutrition they need to thrive. Don't wait. Start today, safeguard your life, and subscribe so you never miss another life-saving tip specifically designed for seniors over 60.